Cognitive impairment is a major problem for many individuals living with multiple sclerosis or MS. Recently, technological advances have allowed for web-based platforms to be used to provide cognitive remediation. And so this is a major advance because the web-based platforms offer features that clinicians can't provide one-on-one, including multiple learning trials to drive optimal learning and adapting in real time to the user, so these advanced features. And in addition, these type of programs offer the advantage of being able to be accessed remotely away from clinic, so at home, for instance. And so our objective was to determine or to test whether one of these programs with these features would lead to cognitive improvement or improvement in cognitive functioning in individuals with MS. And so we studied one of the programs called POSIT Brain HQ, developed by Posit Science Brain HQ, and we compared it to ordinary computer games that had face validity as being challenging but didn't have these advanced features. And we enrolled 135 individuals with MS who were cognitively impaired. Otherwise, it was a really real-world study. We had all subtypes and a broad range of ages. And we randomized them to one of two training conditions, the training with adaptive type of web-based platform cognitive remediation program or ordinary computer games. And we provided them with a computer to take it home, and we monitored them remotely, provided technical support and coaching. We asked them to play an hour a day, 5 days a week for 12 weeks, so pretty intensive training, so targeting 60 hours. And we compared the two conditions. The patients were randomized to one of two conditions. Our primary outcome was change in neuropsychological performance based on a composite measure at baseline, and then repeated again at follow-up. So we averaged scores on tests across tests that are sensitive to cognitive impairment in MS in general. Our main findings first were that we were really excited to see that this was a feasible way to deliver cognitive remediation to patients away from clinic. So having remote support, but having them access the training at home led to really high compliance. So our trial rapidly enrolled and recruited and enrolled, and the patients were very compliant, completing most of the training. When we compared the two conditions, we found actually that participants played or trained in the placebo or active placebo condition, the ordinary computer games, more than the adaptive program. We think that's probably because the games were less challenging in some ways. However, even though the adaptive program was played less, so that group trained less, they showed a significantly greater improvement in cognitive functioning in that condition. And also within the adaptive condition, training condition, the more they played, the greater improvement they had. So we think this is just really an exciting finding because this is directly real-world applicable to these participants and patients with MS, because they may be able to access training, or a physician or neurologist might want to prescribe training programs, and it's helping us understand what somebody with MS might be able to expect and whether they would expect benefit. And again, that they can access these trainings from home. We used a version of it adapted for research, so we selected the training task that we thought would be most helpful for use in MS, so it was a research version of it, but it is commercially available. This type of program, with the features that I described, has been found to lead to cognitive improvements in other conditions with cognitive impairments, such as schizophrenia and some conditions in aging, and some preliminary trials as well in MS, and so this is the first large controlled trial that's demonstrating the benefit in MS, and so we're really excited.